assistant at PERLA, who's working on a cervical cancer screening program in Nicaragua that's being implemented both by PERLA and the MINSA. And the title of her presentation is Self-Sampling for Care HPV DNA Testing in Nicaragua. Please welcome Teah Hoopes.
Hello, I'm Teah Hoopes, and I work for PERLA, as Carolyn explained. So I just like to start off with this slide. This map kind of gives you some background on the incidence of cervical cancer worldwide. As you can see, Nicaragua, which is just below Mexico, I can't point to it, but Nicaragua is one of the countries with higher incidence of cervical cancer cases worldwide. The next two slides here illustrate the comparison to cervical cancer deaths related to pregnancy-related deaths. And this is for Central America. The next slide is for South America. I just do want to say that pregnancy-related death is a very important health issue still. And this is no way to divert programming away from that really important health issue, but just to kind of put cervical cancer deaths in a perspective to a commonly understood health issue. And so if you see the third from the top, it's Nicaragua. The number of cervical cancer deaths is almost 3 times the number of pregnancy-related deaths in the country. And this is, shows a similar story, but for South American countries. So cervical cancer is the 3rd most common cancer among women worldwide. And it's the 2nd most common cause of death for women in developing countries. So I just want to really highlight this last point here is that the main difference between those countries with the high incidence of cervical cancer and the low incidence is access to high coverage, high quality screening and treatment programs. And so that relates back to that map that I just showed you. So in Nicaragua, the current standard of care for screening is pap smear, and that's what it's been historically. So pap smear is that one on the right. They just started implementing VIA, the picture in the middle, which is visual inspection with acetic acid. And while HPV testing is available in the country, it's really not accessible to most women because of the cost. So this is the CARE HPV test. And this is why our project, which I'll explain more in depth later, is collaborating with a private for-profit manufacturer who helped us develop this test. It's suitable for low-resource settings, it's easy to use, and it's affordable for ministries of health like the MINSA, and that is what allows it to be more accessible to more women in the country. So currently our project, which is called Startup, and acronym's really long, sorry, I have to say it all right now. It's Screening Technologies to Advance Rapid Testing for Cervical Cancer, Prevention, and Utility in Program Planning. So that's Startup. Right now we're in 3 different countries, Nicaragua, India, and Uganda. And so you can see Nicaragua is the only country that we're in right now in Central America. So in Nicaragua, specifically the project's in the Masaya district, and we're in 3 stationary health centers, Masaya, La Concepcion, and Tisma, and we're also working with our referral center is the Humberto Alvarado Hospital. So I just want to show you some pictures of the actual clinic in Nicaragua. The picture on the top you'll see is the hallway, actually where the women wait to be screened, and the 2 pictures on the bottom, and that's the actual lab room where the testing happens. And you can see some of the lab technicians in those bottom pictures. And what's interesting about Nicaragua is QIAGEN, the company that designed the test, actually say that the lab technicians in Nicaragua are some of the best technicians in the entire project. So I want to show you the study design, and the design is the same in all 3 countries. Women come in after they're recruited they're screened, and all of the women are offered the opportunity to collect their own self-sample for carriage PD testing. After that, a health provider conducts a pelvic exam, which includes collecting a cervical sample for carriage PD testing and performing PAP and BIA. So after screening happens is when a health provider offers, offers to 20% of the women, which is a random sample, the opportunity to fill out a post-screening questionnaire. And the questionnaire has questions related to how the woman got into the clinic, if she had to ask anyone in her family for permission to be a part of the study, who she had to ask. They also asked if they did take the self-sample, why did they choose to, and if they didn't take it, what was it that made them choose not to take the self-sample themselves. And so this pool of data is the data that I'm going to explain in a little bit more depth. So this is the tool that the health workers use to explain to the women how to take the self-sample. So it's a 6-step process. And though these instructions are in English, the health providers do explain them in Spanish. So preliminary data suggests that the carriage PP test actually detects over 80% of the cases of cervical cancer, and it far outperforms the current standards of care, BIA and PAP, in the country. As you can see, BIA is 68.9% and PAP at 40%. So of the total women screened in our study, over 80% actually have agreed to take that self-sample themselves. This table also shows you that between this screening, the largest screening population, and the subpopulation of women that we have post-screening data on, they are comparable in some of these basic demographic categories. So preliminary results from our study right now, and this is from the population of women that we do have post-screening data on. It says that among the women who provided the self-collected sample, 34% were concerned about the quality of the sample that they would take. They were concerned that it wouldn't be as good as the sample that the provider, the health care provider, would take. 30% of them said that they were afraid of hurting themselves when taking the self-sample. 76.2% thought that the procedure was actually easy. And then half of them said that they preferred it actually to the gynecologic exam. And I do just want to note that among the women who chose not to take the self-sample, they were also concerned with hurting themselves. And so among all of the women we have data on, regardless of whether or not they took the self-sample themselves, they said that the following things would make it easier for them to take the sample themselves in the future. So one of those things was having someone with them during the procedure, actually. Another thing was having more pictures to illustrate the procedure. So currently, the health worker does have pictures and shows the women how to do it before the procedure, but maybe having up more pictures on the wall, things like that to help them. And that's something we're currently working on right now. And lastly, having a hands-on demonstrative tool would really be helpful for women as well. So some of the conclusions from the preliminary data that we have so far is that self-collection could potentially increase access to screening, even bringing it down to the community level. And this would address that disparity in incidence of cervical cancer cases, that map that you saw in the beginning. Also, self-sampling is well accepted and it's highly sensitive for detecting precancer in Nicaragua. Another conclusion we found is that demonstrative resources would be helpful for to alleviate women's fears around self-sampling. And specifically, resources should probably focus on women's fears about taking a good quality sample and about not hurting themselves. And so I would like to acknowledge the workers in Symposium and MINSA, the Ministry of Health in Nicaragua, and also the START teams in Nicaragua and Seattle. Thank you.
His area of interest is in developing and testing service delivery systems for socio-emotional learning prevention programs and strategies, and his recent work focuses on implementing the Communities That Care prevention system, which was developed here at the UW in Colombia. And his title of his presentation, Cross-National Examination